Let's have an honest conversation about how to truly balance your hormones and what that phrase even really means. Hello, wonderful friends. I'm Dr. Emma Mary, a board-certified gynecologist and fertility specialist. I'm here to share what I've learned with all of you, my amazing audience. Every single day, I get asked the same question: how do I balance my hormones? And honestly, that makes me happy. I'm glad people are asking, because it shows a genuine desire to understand how our bodies work, and that's exactly why this channel exists. So, if you're looking to learn more about your body and your fertility, please hit that subscribe button and come along on this journey with me. Now, here's the difficult truth. When people start talking about balancing their hormones, that concern often comes from a place that's filled with a lot of misinformation. And that is not your fault. The reality is, most of us were never properly taught how our bodies function or what normal even looks like. Because of that, it becomes incredibly hard to recognize when something is abnormal. And I'm going to be completely honest with you here. I see patients all the time who come to me after seeing another doctor, maybe a medical doctor, maybe someone in alternative medicine, maybe someone who just calls themselves a hormone expert or specialist, and that person has done things or prescribed treatments that have completely disrupted their body or destroyed their ability to get pregnant. Why? Because the truth is, your hormones are not meant to be balanced every single day. You have a menstrual cycle, and that cycle changes constantly. That changing pattern is what's actually normal. Understanding this allows you to properly interpret lab values, which can be super confusing. So let's dive into what's normal at different times of your cycle, and then we'll talk about what's abnormal. Because yes, there are things you can do, and there are specific abnormalities you absolutely need to be aware of. So, balancing your hormones. Okay, if your hormones are truly balanced, you will have regular periods, meaning regular monthly periods. Also, a quick but important disclaimer: none of this applies if you are on birth control pills. The birth control pill is a combination of ethinyl estradiol and a progestin. It works by stopping your brain from sending out FSH. It's essentially supplementing you with hormones. It has benefits, it has side effects, it can be a great contraceptive option, and it can be used as medical treatment for various conditions. But regardless, you cannot balance your hormones while taking the pill. So if that's you, feel free to stop watching here. But if you're talking about your natural periods off hormones and you're trying to understand if they're balanced, if you have regular cycles that are predictable and consistent, then they're probably already balanced. Someone might tell you otherwise based on a random blood draw, but that's exactly why you need to understand what's normal. Let's walk through the cycle step by step. At the start of the month, I want you to imagine that a group of eggs comes out of the vault inside your ovary. Each of these eggs grows inside a tiny, fluid-filled structure called a follicle. This is important because the eggs themselves are microscopic, but the follicles, those fluid-filled sacs, can actually be seen on an ultrasound. The number of follicles you have correlates directly with how many eggs you have remaining. So if you have more eggs, more follicles come out each month. If you have fewer eggs, fewer follicles come out. That's called your ovarian reserve, and it can be tested with an ultrasound count or a blood test called AMH. I have entire videos dedicated to AMH, so check those out. Now, here's what happens next. That group of follicles, when they first come out of the vault, should each produce a small amount of estrogen. This specific type of estrogen is called estradiol. Other things in our body make estrogen too. For example, fat cells make a slightly different type called estrone. Sometimes people check these as if they're equal, but they're not. In general, estrogen levels talk to your brain to tell it whether a follicle is growing. A tiny amount of estrogen is not enough to signal that a follicle is growing. So the brain responds by sending out FSH, follicle-stimulating hormone, which is a very well-named hormone. FSH works to stimulate one dominant follicle to grow. This is how we begin the process of ovulation. If I check your blood work in the first few days while you're on your period, your FSH should be on the lower side, usually between 5 and 10, and your estrogen should typically be around 20 to 30. If you have PCOS or hypothalamic amenorrhea, this will look different. But in general, things are just starting to gear up. Then we move into the follicular phase. This is the first half of your cycle, from day 1 of your period until you ovulate. It's appropriately named the follicular phase because this is when a follicle is actively growing. The dominant hormone from the brain during this time is FSH, follicle stimulating hormone. FSH gives that follicle the signal to grow. As the follicle grows, it makes estradiol. That estradiol does 2 key things. It thickens the lining of your uterus, and it also makes you feel mentally sharp, energetic, and in the mood to get pregnant. Your female brain loves this high estrogen time. Progesterone, on the other hand, is low. There's essentially none. So if someone checks your blood work during the follicular phase and tells you that you're estrogen dominant, I'm going to say, fantastic. You're supposed to be estrogen dominant in the follicular phase. That's why it's called the follicular phase. This is the time for gains, working out hard, crushing your to-do list, and scheduling all the important things. If you're trying to sync your cycle with your life, you should not have progesterone right now. And one huge mistake I see is people coming in and adding progesterone or progesterone-like compounds or giving people Vitex to take every single day. That is just wrong, wrong, wrong. Okay, so remember, in a normal, natural, perfect cycle, there is no progesterone for half of it. When that follicle reaches maturity, the brain doesn't know where the estrogen came from. It just senses that very high estrogen level for about 50 hours. Then the brain sends out an LH surge. That's ovulation, the follicle ruptures, the egg comes out, and now that follicle reforms into the corpus luteum. The corpus luteum is this fatty, blood-rich cyst that came from the follicle, and it is incredibly important because it responds by making progesterone impulses in response to the brain. The brain sends out LH pulses, which cause progesterone levels to go up and down. We know progesterone can range anywhere from 3 to 40 nanograms at any given moment in the luteal phase, depending on what's happening with those brain surges. So, the luteal phase is the time from ovulation until your next period. This is when you have a corpus luteum and you're making progesterone. Progesterone is the progestational hormone. Now your body is getting ready for a potential pregnancy. You might feel hungrier, progesterone increases appetite, you might bloat a little more, you'll feel a bit less energetic, even fatigued. Your body wants you to take it easy so you can support a possible implantation. If you do get pregnant, the pregnancy latches on and makes HCG. That's the pregnancy hormone you check on a home pregnancy test. HCG rescues the corpus luteum. What does that mean? It means the corpus luteum only lives for about 2 weeks unless a pregnancy occurs. If there is a pregnancy, HCG causes a constant release of progesterone. Your progesterone levels will then go from being up and down to steadily rising. That shift happens once implantation occurs. If you're not pregnant, the corpus luteum dies, progesterone falls, and you get your period. So if you're going to lean into the luteal phase by syncing your cycle, you'll be kinder to yourself. Less intense activities, nourishing your body with nutrient-dense foods, and trying to avoid salty things that will make you bloat even more. Then the cycle continues. A huge topic when it comes to hormone balancing is people with irregular cycles who have PCOS. In PCOS, you have lots of small follicles. Many eggs come out of the vault. Each of those follicles makes a little bit of estrogen, so your resting estrogen levels are a bit higher. This causes the brain to send out a lower level of FSH than it otherwise might, because the brain thinks maybe an egg is already growing. The rule is, when estrogen is high, FSH is lower, because the brain thinks an egg is growing. When estrogen is low, FSH should be higher, because we need an egg. The brain is just trying to get your body to release an egg in perfect synchrony. So, if you have a resting elevated estrogen level, your brain won't send out as strong of an FSH signal, and the FSH signal it does send gets dispersed among all those small follicles. It's not strong enough to get any single follicle to ovulate. That means you won't ovulate, you won't make progesterone, and you won't have a regular cycle. That's part of the problem with PCOS. Now, if someone draws random blood work and says, oh, your estrogen is 40 and your progesterone is 0, you have estrogen dominance, that's not a real thing. You simply have an extended follicular phase because of PCOS. The problem is that you're not ovulating. Giving you progesterone or a progesterone-like compound is not going to make you ovulate. What we need to do is get to the root of the problem. Either lower your resting estrogen so your brain kicks in. You can do this through weight loss. Fat cells make estrone, so weight loss can help. Or use certain natural approaches for PCOS. Eating lots of plant-based foods, getting good and regular sleep to lower inflammation, avoiding sugar and processed foods, and doing moderate exercise every day can sometimes help. But often, PCOS requires ovulation induction medications like letrozole or Clomid, which allow the brain to send out more FSH and therefore trigger ovulation. If you have PCOS, the ovaries aren't making those high estrogen levels they want to, so the ovary gets bored. The ovary is a hormone-making factory. When it can't make estrogen, it gets bored and starts making testosterone. That testosterone from the ovary causes increased hair growth on the face or body, hirsutism, acne, central weight gain, and an overall feeling of not being well. It becomes a vicious cycle. You gain weight, your resting estrogen goes up, and you don't ovulate. Giving someone progesterone for PCOS has its purposes. Number 1, to protect the endometrium. If you're never having a period, those cells sit there and have a risk of developing endometrial cancer, which is one of the worst possible outcomes of PCOS. So taking progesterone will cause the endometrium to bleed when you stop it, because it mimics the luteal phase. That progesterone is not going to make you ovulate for most people. It helps you avoid a bad outcome, but it does not help you get pregnant. Now, if you're not trying to get pregnant, being on daily progesterone is fine. It will prevent endometrial cancer, and it might make you feel more normal if you don't like cyclic progesterone. But that's not normal either. It's not helping you ovulate, and it is not helping you get pregnant. In fact, it is birth control. That's the mini pill. Maybe it's not a combined birth control, maybe it's some fancy compounded version, but taking daily progesterone prevents the lining of the uterus from allowing implantation. Taking scheduled progesterone is unlikely to allow pregnancy either. And I see this all the time. Someone is taking progesterone days 1 through 10, trying to get pregnant, and they're shocked they haven't conceived because their cycles are regular. But you're just having a regular bleed. You're not ovulating, you're not getting to the root of the problem. So I would be very wary when people just check random hormones. Hormones like FSH, LH, estrogen, and progesterone have specific times in the cycle when they should be checked. Estrogen, FSH, and LH should be checked at the very beginning of the cycle, usually days 2 to 4. Progesterone should only be checked about a week after ovulation. Again, there is none in the follicular phase. If you're having random blood work done because you're not having a period at all, that's best combined with an ultrasound so someone can see what's actually happening and interpret the lab values in context. That might be your doctor or it might not, but I would ask about it. Ultimately, I know there's so much confusing information out there about hormones, and I am here to help. Ask your questions in the comments below so we can do a hormone Q&A session soon. I have a lot of great hormone information coming up, especially if you're trying to get pregnant. Learn more about your body in depth, and follow me for more information. Thanks, friends.